Hello, my name's Alexander Landry, and I'm a registered first aid instructor with St. John Ambulance. And today I will be providing you an overview of Household First Aid 101 for Military Family Services Europe. So a quick disclaimer to get started for Military Family Services here. So Military Family Services Europe is not affiliated with any of the companies, apps, or products named in the presentation, namely St. John Ambulance. It's not sponsored by, does not sponsor, and does not endorse any of the companies, apps, or products named in the presentation, although it's understood that both Canadian Red Cross and St. John Ambulance are the first aid providers on that national basis in Canada at this time. So to give a quick outline of the session that we'll have over the next 20 to 25 minutes, we'll look at an introduction to first aid. We'll talk about some common household injuries, citing burns, cuts and wounds, and bites specifically. We'll briefly look at the household first aid kit. We'll go over some review pieces here, and there will be a period for questions and discussions that you could send via email if required, up to the point of contact. So a quick introduction to first aid. It's important to understand that first aid, first and foremost, is the first and immediate assistance that's provided to any person with a minor or serious injury prior to them being received by professional medical services. So essentially, it's the time between they receive that injury or inflicted with that injury and the time they are received by paramedics, registered nurses, or doctors or whatnot towards getting to, their healing process started and actually being seen by professional medical care. Goals of first aid include items such as preservation of life, prevention of worsening the condition, and promotion of recovery. So although we're not attempting to actually heal the injury itself, we are ensuring that it stays in a state that can be healed later on to best ability by those professional medical services. It is important to note that within the scope of first aid in Canada, only trained personnel can provide first aid within the scope of their training. And this is what is applicable for the Good Samaritan law in Canada, which essentially says that first aiders that come to the aid of others that have injuries in the country of Canada cannot be found liable in a court of law if they are acting within the scope of their training and their scope of practice. Now, this being said, the items we're going to cover here today, although you will not receive certification or examinations for, are good stopgaps in understanding different treatments and whatnot to be provided in the event that you have injuries or wounds in the household. So first aid in itself, when you really bear it down to brass tacks, is most of the treatment of shock, which is generally treated by addressing the underlying conditions. Now, shock is really what can create that issue where current existing conditions or wounds get to the point where somebody can lose consciousness and then further entail more serious consequences that might not be something that can be healed by professional medical services. So as we're mostly seeking to preserve life and prevent worsening conditions here, the primary item that has to be considered in first aid is the need to contact emergency services. This is understanding the fact that we necessarily don't have all the answers or the procedures and methods to actually treat wounds or injuries that we might come across, be it in the household, in the workplace, or at play or out in our environment around us. So listed here are some common emergency services numbers, just so everyone is aware that those emergency services numbers may differ from those that are back home in Canada, which would be 911. Such as examples. So in the EU and in Turkey and various countries surrounding the EU or EU applicants, we have the number 112. In the United Kingdom, we have 999. So as we look now towards the meat and potatoes of what this presentation is going to be, we're looking at what the most common household injuries are. So in the average Canadian household, be it abroad or be it at home, the most common injuries stem from hazards inherent to our living habits. These examples include trips and falls, falling objects, burns, cuts and wounds, bites, choking hazards, and chemical ingestion. Although we will talk about trips and falls, falling objects, and chemical ingestion, we're not going to get specifically into the methods to treat them, as they're generally inherent to the actual actions that causes them. Moreover, for choking hazards, it is needed to be understood that the first aid practices that we use to prevent or remediate choking are items that you need to actually certify via qualification. We'll speak about that at the end of the presentation, but for those reasons, we're only going to be covering the bolded items here, be it burns, cuts and wounds, and bites. So to start, we're going to look at burns first. And it's important to understand that when it comes to burns, the priority in terms of first aid, or even just addressing the injury, is to cool the affected area. There's needed to be understanding that there's different types of burns. These vary from thermal burns to chemical burns to electrical burns to radiation burns. Now, the different types are different ways that they are inflicted. So in terms of thermal, we're talking about heat, which is the most common type of burn. However, another colloquially common type of burn is the radiation burn, which we can see through sunburns. There's also chemical burns, evidently, that can occur via contact with corrosive chemicals. And finally, electrical burns, which can occur once you've received an electrical shock to your body, which can be an issue, which we'll talk about in a few minutes, regarding amplifying factors. Now, when it comes to burns and we're talking about different ways of addressing it, we have to consider the severity of the burns, and of which there are three. So in it, we can have a mild, otherwise known as superficial or first-degree burns. We can have moderate or partial thickness, otherwise known as second-degree burns. And we can have critical, full thickness, otherwise known as third-degree burns. Now, when it comes to mild burns, this is generally just from a quick exposure to a heated element. And from here, we're going to see just redness of the skin. There may be small formation of blisters, and this is your least severe type of burn. And it is generally one that can be treated within the household by cooling the affected area and monitoring it, as well as further symptoms such as fever or any shock conditions that might need to enter professional medical services. Now, when we speak about moderate, we're looking more now at actual further redness and blistering and potentially white plasma glucose type based skin affectation. These are more serious burns, and this is one where moderating and actually monitoring of the burn is necessary to ensure that we're not going to need professional medical services. But this is the point now where we're considering if we do need to call them. And when it comes to critical and full thickness burns, this is really when we start to see charring of the skin. We're talking full white skin, full black symptoms here, and actual potential brittleness of the skin itself. And this is the point where it's for sure and certain that you do need to contact professional medical services to actually address this injury. Now, when it comes to burns, there are some amplifying factors that need to be considered. First being the age of the victim. When it comes to the age of the victim, if we're talking about any geriatric or pediatric, meaning elderly or young children and infants, we must consider that at any level of these burns, because of their health conditions underlying or their premature, obviously, growth, they might need to see professional medical services because they are more susceptible to secondary symptoms such as fevers and shock. We also need to consider items such as the location of the burn. So in any part of the body that produces wetness, so be it inside the body, such as the mouth, the eyes, inside your nose, or any of those other areas that produces those wetness areas, essentially, those will not heal properly without professional dedicated medical care and potentially the use of medications. So that would be an amplifying factor in considering when to seek professional medical services. Finally, we need to consider the type of burn. Now, there are some burns that even though you may have been exposed to just a mild superficial symptom, such as chemical burns or electrical burns, you have to consider that there might be underlying conditions that have now affected your body. For chemical burns, the fact is, these chemicals might have adversely affected your body inside, and you have to see a medical professional in this regard to ensure that there's not long-term conditions that may arise from this injury. In terms of electrical burns, there could be issues that affect your heart rhythm, and there could be actual issues in terms of internal burning from the electrical charge that has gone through your body. So in this regard, it is better safe than sorry to contact professional medical services in regards to electrical burns and chemical burns, particularly when you are unsure or in doubt. Speaking to cuts and wounds, another common household injury, we understand that the priority here is going to be to stem the bleeding. Now, there are different types of bleeds as visible on the diagram here. Going from least severe to most severe, the first is the type of capillary bleed, and this is going to be displayed through a slow, even flow. Most scrapes and wounds will include capillary bleed, where a small amount of blood is discharged from the body and is visible throughout. Now, on occasion, there can be cuts that include steady, slow flow and dark red color blood, as opposed to the generic color of blood, which we see with capillaries. This is a venous or veins type of bleed, and it needs to be carefully considered as the depth of the injury could be needing of professional medical services in terms of stitching to remediate the wound. The third and most serious is the arterial or arteries type bleed. Generally, we will see a spurting of blood here. The blood will be much brighter and red in color, and there may be a pulsating flow, which is indicative of the heart rate, essentially pumping out blood to that area. It is important to note that this item requires medical professional services, as an arterial blood flow cannot necessarily be stemmed by household first aid. To this effect, it's important to understand that to stem the bleeding, we can follow the acronym RED, which stands for rest and reassure the member, stands for elevation of the wound, and stands for D with the direct pressure. So generally from here, addressing the wound specifically, as we've outlined here, it's important to note first as the first aider or the member attending it to wash our hands. From there, we want to stop the bleeding by applying pressure. Once the bleed is stopped, we're going to look to clean the wound and remove any dirt and debris. From here, we can make our decision points if we need to contact medical services, essentially. If you are unable to stop the bleeding by applying pressure, you know then that you need to contact medical services. If there seems to be infection or there's an issue with cleaning the wound or removing dirt and debris, another time that you want to contact medical services and professional help. And finally, really, if you're ever in doubt about the wound, if it feels too deep and you're just not unsure about the situation, it's best to contact medical professional services, because from there, they will be able to actually adjudicate and address the wound more appropriately than what you might be able to do in the household. Finally, we're going to look at bites very briefly, mostly considering that many of the countries here on our outcan has many stray animals. At least here in Turkey, there are stray dogs and stray cats essentially everywhere we go. I know so from my travels in Ukraine and Romania as well, that that's an affected cause and there's strays there as well. So it's important to understand this because they may be carrying dangerous diseases or illnesses that could be transmitted to humans should you be bit. Now, the priority with bites is similar to bleeding, but this one turns to wound care and infection prevention, because that is what brings those long-term causes that can create issues later on. It's important to understand there's different types of bites and stings. So the major ones you're going to need to understand are the ones that break the skin and the ones that don't break the skin. So when they don't break the skin, we can talk about addressing the wound, such as I have listed right here. When they do break the skin and there's severe bleeding that might be incurred, it is important to contact medical assistance at this point to ensure that we're being treated for potential infections, such as rabies or any other illnesses that might be passed on. And they'll essentially, based on the animal that may have bitten you, the professional medical services will be able to provide you further advice on any treatments you may need to undergo regarding antibiotics, or what type of animal may be carrying what common diseases are out there currently with those animal strains. If it does not break the skin and you're looking to address the wound, importantly to note, the first thing is to wash your hands. From here, you're looking to apply cold and damp dressing to clean the wound. So you're not looking necessarily to flush it right off the bat, particularly if it may cause further debris and whatnot to inflow into any part of your body. You're going to look to remove any dirt and debris, evidently, and then you're potentially going to look to apply over-the-counter cream and ointment, which is optional, evidently, based on personal preference. But these are generally available at your local exames, local pharmacies, apothecaries, or whatever the name for that establishment might be in the country you currently reside. Knowing when to get medical assistance, as you mentioned, so if it breaks the skin, you're going to want to go right then and there for potential for infections. You're looking at things like rabies. You'll probably be administered some vaccines or some reactionary doses. It's also important to understand that regarding certain types of stings, such as with bees, there is potential for an allergy that you may or may not be aware of. So in this, a person may be susceptible to what's called anaphylactic shock, which is essentially a reaction of the body to stem the flow of any venom or poison that may have been introduced into the body by the sting or the bite. To this effect, generally people that are susceptible to anaphylactic shock are aware of it and are aware of their allergies, and they may be carrying an EpiPen, and you should familiarize yourself with that if you have loved ones that do carry an EpiPen. If not, if at any point you notice a person who has been bitten or stung beginning to have trouble breathing or continuing to shake or is entering any state of shock, which we briefly mentioned at the beginning, at this point, you are going to want to contact medical assistance immediately, as their life may be in danger. Moving into the household first aid kit, which is really the bulk of what we should be talking about today, mostly understanding that everyone in this presentation or watching this is highly encouraged to have one of these in their household. It's important first to understand that a tool is only really as effective as its user and its use of that tool. So the importance of that is knowing the location of the first aid kit at all times, and also understanding the use of the different tools we put in there. Now, items that I've listed here is definitely not a list that is exhaustive, but it gives you a good idea of different tools that you might want to have in your first aid kit to be able to assist you should you encounter any of the items we've talked about over the past few minutes within household first aid. The first being phone numbers. So it's important to have a list here noted of the emergency phone numbers, potentially your doctor, items such as poison control for that chemical ingestion, which we talked about earlier, and then family and friends, because the reality is in situations of emergency, you or your loved ones may be incapable of escorting yourselves to the hospital or seeking that assistance. And by having phone numbers for family and friends, you may be able to resort to that network to be able to support you and assist you in getting you to those medical services, or potentially for the aftercare effects that are required should somebody be hospitalized in your household. We're looking at things here as sterile gauze dressings. We're talking about adhesive tape, bandages. You're going to have scissors and tweezers, specifically the medical kind, which will be able to assist you there. You're going to want instant ice packs, which will treat things like burns or assist in cooling those areas. Definitely disposable gloves, especially above and beyond that idea of washing the hands. You're going to want to look at antiseptic wipes. I'll mention really quickly here the CPR mask, which has the valve, which we could talk about when we get to the actual qualification portion that I'll mention quickly at the end. And there's also the first aid guide, which will provide you any advice sanctioned by St. John Ambulance, which is readily available online. It can be printed via PDF version. Now, the two I've mentioned here that I've passed over here, not mentioned, that I'll quickly come back to are the pencil and notepad and the emergency blanket. Now, the emergency blanket is useful in any situation where a person may undergo shock, because in a shock situation, the person's going to begin feeling cold as the blood within their extremities starts rushing to the internal organs to begin sheltering essentially and entering those states where they're trying to protect the most vital pieces of their body. That emergency blanket will provide heat to that person, which will assist them in subduing the effects of shock before they reach the medical services. Finally, the pencil and notepad is critical here because it provides you a tool and a mechanism in which to take notes regarding what might have happened in terms of the injury. So potentially the history leading up to the injury, what might have caused it, any items that you have conducted in terms of household first aid and assisting that person, any medication that person might have taken, and all these different types of information that you might need to hand off to professional medical services, which should be easier to write prior to or after when you have no more adrenaline flowing through your body and you're not reacting to the situation at hand. Now, just looking quickly at further suggestions and discussion here. So again, I'll mention it's very important to know where the first aid kit is. So the first aid kit is only as good in your household as the people using it and their understanding of it. If you come to the emergency situation, you're going to fall back onto your most recent training. And if you haven't reviewed recently or have at least an understanding of where the first aid kit is and how to use it in an emergency situation, you're likely not going to be able to leverage it to appropriately apply it to the situation at hand. It's recommended to review the contents of the first aid kit regularly and have an inventory list for used items in there. So once you use items, sometimes you may forget following the emergency situation to replenish it. Moreover, some of the items in there may have expiry dates, or the antiseptic wipes, for example, might dry out. And these are things you want to prevent. It's recommended to do this on at least a quarterly basis, or at least as often as you check your smoke detectors within your household. Finally, you want to look at household preparation itself, because prevention and preparation is the easiest way to ensure that we're not in a reactive state and that the emergency situations don't happen. So for things like choking, you want to account for choking hazards, especially if you have small children within your household. For trips and falls, try and keep the house tidy. Don't have items on the floor and whatnot that might be sprawling out. And for falling objects, anything that's above your shoulder height should be stored properly or at least secured. This is specifically an issue for places like Turkey and Greece, where we know that there's fault lines that create earthquake situations more often than not, and can be in danger if we have items that are hanging on the walls or specifically above shoulder height. And finally, for chemical ingestion, you want to know proper storage of chemicals. Generally, the material safety data sheets or on the back of all the chemicals we procure ourselves have the information. And if it's not available because it's in a different language, when you're buying chemicals and whatnot and storing them in your household, it is a good idea to do the research online to ensure that you're finding out what the parallel chemical might be back home in Canada and how to account for that and what the different storage precautions might be. Quickly here, I'll mention the St. John First Ambulance the St. John Ambulance First Aid Reference Guide. And it's important to understand that there is some copies available in GK, and it's also available online as a downloadable format for PDF. Now you can download this, print it off, have it available and whatnot in your first aid kit, because it does provide some guidance in some situations on what to do and how to react above and beyond what we've talked about in the session today. It's also recommended for further training. It's needed to understand that there is now the standard first aid course and a hybrid method offered by St. John Ambulance, as well as the Canadian Red Cross, and that these can be just generically found out about online just by doing the research. GK can also provide further assistance through the PFP and MFSE, who may have further contacts in that regard in terms of the first aid instructors, should you be interested. St. John Ambulance also offers a babysitter's course, which is very valuable to have if you have younger children or older children watching over your younger children. And finally, there's a new program regarding mental health first aid, which is highly recommended. It's not a piece we touched on today, but understanding the difficult situations of being deployed on an outcan, being away from family and your support networks, it is definitely a good spot to learn about some tools, tips, and tricks that speaks to how to cope with situations and difficult undertakings such as an outcan or deployment of a loved one. And these are pieces that can help you better yourself and better your household as you move forward within the scope of first aid. So again, that concludes really this brief presentation on household first aid today, really a little 101. I hope you did pick up a couple pieces and you can quickly come reference this should you have any issues, preferably not in the middle of an emergency situation itself. I'll remain available via email or essentially through the MFSE points of contact should you have any questions. And don't forget that St. John Ambulance and Canadian Red Cross have available references online that you can always consult, preferably before the emergency situation occurs. And I thank MFSE today for having me. It's been quite a pleasure.